Mrs. Indrani Balachandran, a retired teacher from Sri Lanka. I had some heart problem. We consulted cardiologist from Sri Lanka and did echo and found that I had to replace my aortic valve and I had to undergo a surgery. Since my age is 79, I didn't want to do it because I didn't want to take the risk of my life. So I thought better to find a person, an experienced person who can do that so that I can be relieved. I went through the internet and found an experienced person named Dr. G.Sengottuvelu from Apollo Hospital. We thought that he is the proper person to do that, and we wanted to have a Zoom meeting with him, and about 5 of us had a meeting with him, and all the 5 of us were impressed by the way he spoke, the way he expressed everything. We were impressed, and we thought that he would be the proper person for us. Then we decided to go to India to Apollo Hospital, and as an international patient, then we got admitted and he did the TAVI process, and he did that wonderfully well, without any pain, which I didn't feel at all. Really, it is highly commendable. His work is remarkable. I was highly relieved, and we wish that he should do and give relief to many humans in the near future. May God bless him forever.
So this 79-year-old diabetic lady from Sri Lanka, Colombo, came to us with severe symptoms and was diagnosed to have severe aortic stenosis. Once she was here, we did a clinical evaluation, which was followed by echocardiographic evaluation and then a CT. Following all these investigations, we discussed all the clinical features, the severity of symptoms, as well as the echocardiogram and the CT features. Clearly for her, she had a tricuspid valve which was highly calcified. The coronary arteries were adequately in heights, so she was clearly suitable for TAVI. Considering that she has comorbid conditions as well as the age of 79 years, TAVI is a much more simpler procedure compared to open heart surgery. So she was admitted one day prior to the procedure. The next day she was taken up under local anesthesia, and the procedure was done using conscious sedation, and we did a direct implantation of the valve with the Edwards Sapien 3 valve. Again, based on the CT features, this is the best suited valve. We were able to give the best result with this valve. So once we deployed the valve at nominal volume, then we also post-dilated the lower part of the valve with the balloon with slightly protruding into the LVOT to achieve the best outcome. So the final result was excellent, with very minimal gradients, with no significant paravalvular leak, and she was since she was on local anesthesia, she was able to quickly get mobilized, and the evening she was much more comfortable and started walking the next day. She was observed and we quickly discharged these patients. So the biggest advantage is we are able to precisely analyze a patient specific tailor-made valve suitable for that particular patient, and we are able to achieve all this in a minimally invasive way, which we call as minimally invasive TAVI. So the patient is done under local anesthesia, and the procedure is made very simple with about 45 minutes, and then the patient is discharged very early, sometimes even the next day after the procedure. So she was doing very well at the time of discharge, and I have advised her to fly back to Colombo the next day.